Today is World Thrombosis Day, and while many of you probably don't know the significance of that word, you will in just a moment. Here to explain thrombosis, we have Dr. David Calcagno of Calcagno and Rossi Vein Treatment Center. We also have patient Deborah Fingerlow with us today. Welcome, Deborah. Welcome back, doctor. So, thrombosis, I did not know what this is before today's show. What is it?
Well, today, Monday, October 13th, is the first World Thrombosis Day.
Oh, it's the first.
It was a day put together by medical societies around the globe to bring attention to the process of thrombosis. Thrombosis is just the medical word for the clotting of blood.
Okay. So how does this pertain to varicose veins?
Well, I'm glad you asked that, because that's what we're going to talk about today, specifically the relationship between varicose veins and thrombosis.
Okay.
As we've talked about before on the program, patients with large varicose veins usually have valve reflux, where the valve's not sealing correctly and the blood's not going back to the heart like it should.
Okay.
Unlike water that stays liquid when it stagnates, blood can clot, forming thrombosis.
Okay.
Additionally, the patients can get inflammation around that clot, causing phlebitis. So together, the word's called venous thrombophlebitis.
Easy for you to say. So here's the thing, when I think about blood clots, I really think about something kind of deep in your body, and I think of varicose veins as something right there on the surface, but again, these clots can happen right in those surface veins.
Well, Amy, you're exactly right. A surface vein clot is not as dangerous as a clot in your deep veins or in your lungs. However, surface clots are not as benign as they were once thought. With better imaging tests of the lungs and the legs, we've now found that surface clots can be associated with deep vein clots and even clots in the lungs.
Wow, that's kind of scary to think about. So we're talking about superficial phlebitis. What are the symptoms?
Well, if you don't mind, I might turn that question over to Deborah.
Okay, help us out. You've been through this.
I have, unfortunately, I have. The symptoms are pain. Right around the vein will get hard, red. It feels very uncomfortable.
And you can see it right through your skin?
And you can see it, you can see it. Mine is behind my knee and actually went down my calf, and I could feel the red. It felt like if you get a bite from a hornet or something like that, and you have a welt.
Yeah.
That's what it felt like, and the whole area was hot. I'd been in a long car ride.
It's hot.
And mine was warm. So when I actually went into the ER, just because you hear about people with long car rides and you have a blood clot, so maybe it should be checked out. Thankfully, no blood clot, but still something to be taken care of. So,
is this something that developed over a long period of time, or did you always have the varicose veins
Unfortunately, I always had this one vein, but it never bothered me, ever. And now this has come to pass in this past summer. So hopefully Dr. Calcagno is going to take care of it for me. And while he says I may not run faster, I will at least run happier.
Oh, that'll be good. That'll be good. So you haven't had the treatment yet?
No, I have not.
Okay, so then how do you treat this, doctor?
Well, when someone has the acute process of the superficial thrombophlebitis like Deborah had in July, the treatment's aimed at two things. One, to control the pain or the inflammation, which you can do with warm compresses or anti-inflammatory agents like Advil or Motrin. But the more important thing to do is to make sure that the process is confined to the surface vein systems, and it's not either in another deep vein in the leg or getting too close to the deep veins, in which case you would have to treat with anticoagulation or blood thinners.
Wow. So, you think of varicose veins, we've talked about this before, as something that's just a kind of a nuisance or a cosmetic, but this proves to me, this topic, just how serious something like that can be. If we want more information, doctor, how do we get in touch with you?
Well, the easiest thing would just be to call our office and come in and talk to us, and we'd take a look at the individual person's situation and come up with a good plan.
Very good, and thank you so much for sharing your story with us. We wish you the best. Maybe you'll be back to tell us about your success.
Anytime.
Thank you. Okay, we'll be right back with more Good Day PA.
Call 888-720-3599.